Hey, so the question today is how can I know if I'm doing my self treatment, my self care right or effectively? Sometimes I don't feel anything, sometimes things go numb, and that's numb or tingly or whatever. That's a common thing. Um, First off, the thing that you want to most watch out for is that you're not gripping, clenching, trying to shove through. We all start off doing things too hard. So we push and we struggle or even we have the ball that we're lying on too firm and it's too hard into our tissues and it's just too uncomfortable and we can't soften and relax over it. So we don't want any of that. If you're doing at all any of that gripping, clenching, bracing, trying to get through it, oh, that kind of let's get that thing to release, back off of that because that's not going to be very helpful. Certainly not very helpful at all long term. Temporary results at best. Aggravation, pretty much at worst. You probably won't hurt anything that way unless you're way too aggressive, but no need to aggravate anything. So watch out for the clenching and bracing, and that just comes with a sense of being able to soften into it. Feel a sense of slowing down. Drop the busyness in your head, the sense of trying to do something, trying to get it right. If you're trying to do it and get it right, you're up in your head and you'll be wasting your time for the most part. So, first off, just plain soften, quiet your mind, allow everything to start to drop, to start to settle, to start to melt. And if that's all you get, that's still better than not getting that. So, relax a little bit about it. Now, assuming that you have been able to soften, then the next thing that you're looking for is a sense of tissue stretching, peeling, melting, lengthening, a sense of your body or your structure, your back settling, letting go, almost breathing a sigh of relief. As it first starts to settle into something, oh, that's a little uncomfortable, it's a little difficult to do that, but as I stay and I soften and I allow that, it kind of maybe flares in intensity for a moment or two, and then it softens and settles out and it becomes easier, easy, and comfortable to be where it was difficult a moment before. That way you definitely know you're doing something good for yourself. Now, if you're not feeling anything, chances are you're not in a place that's really doing much. Either it's too stuck for you to feel it doing anything yet, or you're not doing much. Give it a minute or two and just imagine the area melting. If it's still not doing anything, try shifting things around. See if you can find a spot, shift the angle a little bit, shift the pressure spot a little bit, and see if you can find a place, or totally change the area and look for something else that's more accessible. See if you can find a spot where you can start to feel something softening, stretching, opening, settling. Now, if you're talking about the tingling, arms going numb, legs going numb, whatever it is, that's okay, provided that you're not pushing, that you're not into that, let's do something, let's reach that, let's stretch that, let's get that to release. You're probably pushing. If you're not doing that and something's going numb and tingling, it's probably okay. If it's a little too intense, then just simply back off a little bit. Shift your arm from here to here, perhaps. Back it off a little bit and see if that helps. It'll be okay. Nerves and circulation tend to get challenged by restricted tissues when we start to release them, and we tend to bring up symptoms. So the checkpoint is not whether it's numb or tingling, it's can I soften through it? If you can, you're doing yourself good. If you're tight and you're pushing and you're trying to release, let it go. Back off. You're not doing yourself any good that way. Hope that helps, and let me know how it goes.